Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Can you buy at-home strep tests? At-home strep tests aren't yet approved by the Food and Drug Administration, FDA, for use at home. Once they are, at-home rapid strep tests are likely to become widely available for purchase online or in pharmacies. Rapid strep tests are around 86% accurate at detecting a strep infection. /r/n/r/n A rapid test for strep gives results in minutes. Although they can't be used to make a definitive diagnosis, an at-home version could be useful for helping you decide whether you need to see a healthcare provider. /r/n/r/n Healthcare providers have been using rapid strep tests to diagnose strep throat since the 1980s. Although they aren't yet available over the counter, research has shown that parents feel confident about using them to test for strep at home. /r/n/r/n Here's what you need to know about these tests, how they're used, and how accurate they are. /r/n/r/n No rapid tests for strep are approved by the FDA for healthcare professionals. They are not approved for home use, even if the box says FDA approved or FDA cleared. A brand of rapid strep test intended for home use is currently undergoing clinical trials for approval by the FDA. /r/n/r/n If the FDA approves a home strep test kit, it is likely to become widely available. You may be able to buy at-home strep tests either online or in pharmacies before this formal approval. /r/n/r/n Make sure you buy from a reputable outlet, no matter where you purchase the kit. The kits should be the same as those distributed to healthcare professionals. /r/n/r/n Strep throat is caused by group A Streptococcus bacteria. Up to about 25% of sore throats in children are due to strep. A rapid strep test determines whether this bacterium is present. It will not detect viral causes of a sore throat. /r/n/r/n If you or your child has a sore throat with a fever, an at-home test could help determine whether to contact a healthcare professional about treatment. Symptoms that make it less likely that a sore throat is due to strep throat include cough, runny nose, hoarseness, and pink eye. /r/n/r/n At-home tests may be particularly useful for children between 5 and 15 years old. Though complications are not common, these children are at a higher risk of developing rheumatic fever or other conditions that can damage various organs, including the heart and kidneys. /r/n/r/n Adults and children under age 3 are at lower risk for strep and complications if they get strep throat. In these age groups, strep throat may resolve without treatment. /r/n/r/n Done correctly, at-home strep tests accurately detect strep about 86% of the time, according to a 2016 study. A negative test is estimated to be accurate about 95% of the time. /r/n/r/n False negative results, in which strep throat is present but the test shows it is not, can occur. If the test is negative, you may still choose to consult a healthcare provider to confirm the result or to find out what is causing the symptoms. /r/n/r/n Up to 15% of children may have strep but no symptoms. A healthcare provider may determine these children do not need antibiotics. /r/n/r/n A rapid test performed by a healthcare provider or a throat culture taken during a visit to a healthcare provider can confirm a strep diagnosis. Some healthcare providers may prescribe antibiotics via telemedicine after an at-home test, but check with your healthcare provider. /r/n/r/n Unlike a sore throat caused by a virus, strep can be treated with antibiotics. Treatment can shorten the illness, stop the spread of it to others, and prevent serious but rare complications. /r/n/r/n While an at-home rapid strep throat test will give you a result in minutes, you'll need to contact a healthcare provider for a diagnosis of the infection and to get a prescription for antibiotics. /r/n/r/n. Though an at-home strep test may be less expensive than going to a healthcare provider, bear in mind that you may still need confirmation of either a positive or negative result, and you cannot get antibiotics without a prescription. /r/n/r/n. At-home rapid test kits generally follow a similar set of instructions, but read the directions carefully before you proceed. /r/n/r/n. Typically, you mix 2 vials of liquid into a tube. Use the swab included in the kit to collect a sample of mucus from the back of the throat and swirl it into the tube. /r/n/r/n. You need to do the test right away by adding a few drops of the mixture to a test strip or a small well. The test will show results after a few minutes. /r/n/r/n. Generally, you have about 15 minutes to read the results before the test is no longer valid. Remember that instructions may vary depending on which brand of test you've obtained. /r/n/r/n. Usually, the test strip has a control line that you'll see when you look at it. If another line appears after you put the sample on it, even if it's faint, that is a positive result for Strep A. If no line appears, the result is negative. /r/n/r/n. Remember that although these tests are generally accurate when done correctly, they are not 100% reliable and can give you a false positive, indicating the illness exists when it does not, or a false negative. /r/n/r/n. Even if the results of a home strep test are negative, you should consider checking with a healthcare provider, particularly if the test is done on a child age 5 to 15, who may be at higher risk for complications. /r/n/r/n. The healthcare provider can do a rapid strep test and may also take a throat culture, which will be analyzed in a lab and is considered a definitive diagnosis. /r/n/r/n. If the rapid test is positive and the person has symptoms, the healthcare provider can prescribe a course of antibiotics, usually given for 10 days, to kill the strep bacteria. /r/n/r/n. At-home strep tests are likely to become widely available once they have been approved by the FDA. These rapid strep tests are generally accurate when done correctly. However, they may give false positive or false negative results. /r/n/r/n. If your rapid strep test is positive and your healthcare provider confirms the diagnosis, you will receive a prescription for antibiotics to cure bacterial infection. If the result is negative, you may still want to consult a healthcare provider in case the test wasn't done properly, the result is inaccurate, or you have another condition that's causing the sore throat. /r/n/r/n. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.